guys, today we're going to go be seeing a patient that has hyperemesis gravidarum. So hyperemesis gravidarum is a severe form of nausea and vomiting of pregnancy that results in dehydration, weight loss, electrolyte imbalance, and the need for hospitalization.
The background of hyperemesis gravidarum is unknown. However, it does decrease placental blood flow, it decreases maternal flow, and sometimes can cause acidosis, which can threaten the health of both mom and baby. All right, let's go see a patient.
Hello, good morning.
Good morning.
My name is Kat. I'm going to be your nurse today. Can you tell me your name and your birthday?
Jennifer, and my date of birth is 2379.
All right, Jennifer, can you tell me what's been going on? What brought you to the ER today?
Well, I'm still getting like morning sickness or even all day sickness really, but I'm 26 weeks. I thought this would be done by now.
Okay, how often are you vomiting?
Pretty much on and off all day, like 4, 5, maybe 6 times a day sometimes.
Okay, like right after you eat, or does it take a little while?
Well, I really haven't been eating too much because I can't hold anything down, so I've just kind of given up on trying because I'm so nauseous.
Okay.
Just to smell it even.
Have you guys tried any medications at home to kind of ease the nausea, vomiting?
No, she can't hold anything down. She can't even hold down water.
Okay, so it's been really difficult.
Yeah.
Have you noticed what the vomit looks like? The color or consistency?
It's just, sometimes it looks like almost like there's a little bit of blood in it. It has kind of a coffee ground look to it. I do miss coffee though.
Yeah, I bet. Any feelings that are changing as far as your emotions? Do you feel more tired than usual, more moody than usual, anything like that? Yeah, hubby says yes.
Well, I've been really tired. Like it's just hard to even get up and do anything. And it's making me feel really sad and aggravated because I'm usually somebody who moves around a lot, but
I gotcha. Okay. Well, I'm gonna go get the doctor, and we're gonna go over all the symptoms, and we'll see what he says. Okay? Good morning. How's everybody doing?
We're all right.
Yeah, not feeling so well. So your nurse updated me on what's going on, and she let me know that you are having twins, and it is your first pregnancy. So both of those factors put you at a higher risk for something called hyperemesis gravidarum, which is excessive nausea and vomiting throughout your pregnancy that kind of lasts all day long. This can lead to some different things like acidosis that put you and the baby at risk. So we're going to go ahead and make sure to run some labs to check for acidosis. We're going to get you hooked up to some IV fluids to make sure you don't get dehydrated, and some Zofran as well, which is some antiemetic medication, which is going to help you with your nausea and vomiting, okay?
She can't take medication, like she always just throws it up.
She always just throws up. We're going to go ahead and hook it through the IV line so she won't have to swallow it or anything like that, okay? We're also going to put her on an NPO status, which means that you can't have anything by mouth, any liquid or food, just until we get the nausea and vomiting under control, okay?
Okay.
Do you guys have any questions?
no, I'm ready to be done with this.
Okay, I'm going to send your nurse in to get that all hooked up and going for you, okay?
All right,
All right,
thank you.
we'll see you guys later. Knock, knock.
Hey.
Hi, okay, so did you guys get to talk to the doctor?
Yes.
Did you get all your questions answered? Kind of?
So far, yeah.
Okay.
I didn't understand everything, but
Yeah, well, we'll help you with that. He did order some fluids, so we're gonna hook her up to that, and then we're gonna give her some Zofran to take care of any nausea she may have right now. And you know not to bring her any snacks, don't bring her any drinks, no coffee, none of that, okay? Just for now. I know, I'm sorry, but we gotta let your gut rest a little bit. All right, can I squeeze in there real quick?
Yeah.
Thank you. Okay, so this is lactated bringers. It's a fluid that's going to rehydrate you. It carries the electrolytes that you need to feel better, okay? Let me take a peek at your IV site. All right, so that's that. And then this is Zofran, okay? It's going to help you with the nausea a little bit. Okay, so you just rest, and if you need anything, hit your call bell and we'll be back, okay?
thank you.
Knock, knock, it's me again.
Hey.
I'm gonna have to take some blood from her real quick.
Okay.
All right, can you tell me your name and birthday?
Jennifer, 2379.
Okay, just gonna take it right out of your IV, okay? This is to send to the lab to see if there's any metabolic acidosis imbalances in your blood, just to make sure that you and baby
All right, okay. I'll be back later.
Good morning, guys. My name
Morning.
is Jenna. I'm going to be your nurse today. How are you feeling this morning?
Feeling a lot better.
That's great. So you have been here overnight, so we ran some secondary labs and everything's looking okay. So the doctor's going to discharge you guys soon. I'm just going to go over some discharge instructions to help you when you get home, because even though you're feeling better now, it doesn't mean that it can't happen again. So we're going to give you some instructions and some things to help to minimize the effect of it if it does happen again, okay?
Okay.
So I do have this paper handout here. Some of the things are just avoiding any strong flavors or smells, anything that might make you sick. Avoid tight waistbands because the pressure on the abdomen can make you more nauseous. You want to eat small, frequent meals, because if you eat too much at one time, it can kind of upset your GI system. So they recommend about 6 small meals a day. You want to avoid any fatty foods. You want to take frequent rest periods. So if you're engaging in a lot of activity, make sure that you do rest because your body needs it. And then when you wake up in the morning, before you get out of bed, you want to maybe eat some saltine crackers because it helps get your digestive system going. And you just want to rise slowly. You don't want to just jump right out of bed, okay? Do you guys have any questions for me?
No, jumping out of bed really isn't an option for me these days anyways.
Well, I'm going to send you guys home with this, and I wish you the best of luck, okay?
Thank you so
Thank
Of
you.
much.
course.
All right, welcome back. So as you saw throughout our scenario, our patient had most of the common symptoms that come with hyperemesis gravidarum. She had unrelenting nausea and vomiting. She had that mucousy, bloody, coffee ground look to her vomit. She has also a rapid pulse. She did complain of a headache and constantly feeling tired. She wasn't sleeping well, and she also had dry mucous membranes. So those were all in line with hyperemesis gravidarum. The nurse in the video did do some of the common interventions that her doctor ordered, which she hung fluids to get the patient rehydrated again. She administered Zofran to help with the nausea and vomiting, and
She drew some labs.
she drew some labs to see if the patient was going into metabolic acidosis, which in this case, thankfully, she was not.
All right, so next we're going to talk about some risk factors. So overall, some risk factors of hyperemesis gravidarum are young age, nausea and vomiting with previous pregnancy, history of intolerance of oral contraceptives, null parity, multiple gestation, stress, obesity, and GI reflux. So with this patient specifically, the null parity, it being her first child, and the fact that she was having twins, put her at an increased risk for hyperemesis gravidarum. If this specific condition goes untreated, it can often lead to neurological disturbances, renal damage, dehydration, ketosis, alkalosis from loss of hydrochloric acid, hypokalemia, and retinal hemorrhage or death. So next we're going to put in some questions that you guys can answer to test your knowledge of this scenario. Thanks.
All right, and now to test our knowledge, there is a Kahoot game. Enter the name hyperemesis gravidarum, capital O, capital B. It is hosted by that name, which is me, Kat Gabriv. And let's see how everybody does.